Hey there, District 2. Andrew Scott Smith here again today. I want to talk to you about how I plan to achieve my third R in my commitment to you, and that's Revive and Rethink Healthcare. It's no secret that our healthcare system is in absolute crisis mode, to say the least. It's a disaster. It's time we reimagine and rethink what healthcare is, what it can be, and access to quality healthcare. People shouldn't be faced with the choice between healthcare and financial burden. Our rural hospitals shouldn't be on the verge of closing, where somebody may have to drive 50, 100 miles or more now, or God forbid, just hope you make it to Jackson. That shouldn't be an answer. That shouldn't be an answer at all. Think about this. Franklin County has one hospital. It's in Meadville. It's the only thing on 84 really between Natchez and Brookhaven, medical wise, besides some clinics. But hospitals, it's the only one. There's a definition right now, and because of some mileage, if something were to happen, God forbid, to that building, that hospital there, Franklin County, if it were to be wiped off the face of the earth, they could not rebuild that hospital. All of those residents that live in Franklin County would hope they either made it to Natchez, Brookhaven, or to Jackson. That's not an acceptable solution. Same thing is true with Greenwood LaFleur, who's on the verge of closing right now. They're doing everything they can to keep the doors open. And another problem is the undue financial burden that is placed onto our hospitals. The larger hospitals and systems can take larger financial blows. It's still not great, but they can absorb them. For our rural hospitals, these drastic financial swings can mean life and death. But if there's somebody who's not approved for something but still needs care, they're not just going to turn them out in the cold. But that cost is still incurred. And if that patient can't afford it, it falls onto the hospital, which may or may not can take the blow. And it's really put a strain on some of these hospitals. It's time we rebuild the resources that we put behind our hospital and our healthcare system. I'm glad to say I've met with some of our hospital administrators, and there is still hope on the horizon, but it's not a whole lot left. It's time we do something to fix this now before it's too late. My office will be completely dedicated to making sure that the full force of federal resources that we have available are put behind these hospitals to not only make sure that they stay open for right now, but we need some kind of actionable legislation to be able to put forward and keep them open. Our hospitals shouldn't have to worry if they're going to have the money to keep funding and keep the doors open. They shouldn't have to worry if they can build a new facility or not. They shouldn't have to worry about, is somebody going to be up there fighting for them? Because I will. And our veterans. If you've served this country should serve you. You ought to have the right to choose your provider. I'm not saying anything's wrong with the VA, but you shouldn't be locked into a system that may not work for you. And another thing, we should rebuild our mental institutions. There are people that have serious mental issues that need help. I'm not talking about the lobotomy centers of the past, folks. I'm talking about new, modern healthcare. We know so much more now about mental health than what we did in the past. We can help people, and we should help people. There are a lot of homeless people that are on the streets right now because they suffer from some kind of mental condition and they're not able to get the help that they need. That shouldn't be allowed. We should honestly be ashamed. It's time that we step up and do something. Let's rebuild these institutions. Get these people the help they need. Get the folks that shouldn't be walking around who have some dangerous conditions away from me and you. Let's make our communities safer and saner. I don't think that the big healthcare companies are being held accountable in any shape, form, or fashion. And I think it's time somebody put their feet to the flames and made them answer and responsible and accountable to you. It's really in their best interest to make sure that you're healthy, because there's less risk if you're healthy, right? We need to move things more towards preventative-based care and not just trying to treat a problem, but cure things. Let's not just worry about a recurring revenue stream off of a customer's illness. Let's actually cure people. Let's make solutions that make things better. It's going to take a lot of work, and this isn't the entire plan. It's a very complex subject. I do plan on continuing to have the conversations that we've started. Let's build on this together, find out what works, what doesn't, and let's actually fix this problem. I will make this promise to you. I will do everything in my power to make sure that each and every resident of the district has access to quality, not only just health care, but holistic health care. Mental health, emotional health, physical well-being, all of it. It's an all-inclusive package. I believe in finding cures, not treatments. My name is Andrew Scott Smith. I'm running to be your U.S. representative for District 2, and I'd appreciate your vote on March 12th in the primaries and again this November on the general. Thanks.